In this video, I am going to do a treatment for hip joint and pelvis. Before I work on the pelvic girdle, I will check range of motion. Hip flexion, little bit tight on back side. He wears the jeans that may give a restriction for joint. However, some work can help increasing range of mobility even though he wears jeans. Okay, so I work on the myofascia here. This is gluteus medius and gluteus minimus. These muscles are very important for hip movement, hip stability, pelvic movement, and pelvic stability. Very, very crucial in this area. Good. Range of motion check. Nice. And I feel his posterior part of hip joint is tight. I will show you on the model because you don't see what I'm doing. So I'm going to work on this place. You see this beige tape? This represents the posterior part of hip joint. This is ischiofemoral ligament. If this ligament gets tight or gets shortened, it will inhibit hip movement. Okay, so I'm going to work on this ligament. You don't see my hand placement, that's why I showed you on the model right here. I'm on posterior to hip joint. That's it. Nice. Let's check movement. Very nice. You see the difference? It's much better, right? And I think his posterior part of pelvis is tight, but right here, this area. This area is also important because there is gluteus maximus on the inferior part. On the upper part, there are many core muscles and back muscles. So posterior part of pelvis. Great. You know what? I'm going to work on anterior part of hip joint. Nice. Range of motion check. Much better. It's very, very nice. So what I did was I did myofascial release around this area, gluteus medius and gluteus minimus, and I worked on posterior part of hip joint. That was ischiofemoral ligament. By the way, the last one was iliofemoral ligament. So I worked on 2 ligaments of hip joint. Then I did myofascial release around iliac crest, especially superior part. There is a core muscle and back muscle attached here. So this is today's video. If you liked today's video, please like, comment, and subscribe. See you next video.